What are the 4 stages of back pain? So we're going to talk to you today about which stage you may be in. If you are suffering with back pain, I'm going to tell you exactly what you need to do in each stage and how you can get through into the next one to ensure that you're correcting this problem long term. So we have 4 stages of back pain. The first stage is going to be the instability phase. The second phase is the dysfunction phase. The third phase is the pain phase. And the fourth phase is recovery. So instability, dysfunction, pain, recovery. So I'm Dr. Jeremy Andrews, Doctor of Chiropractic here at West Chiropractic in Surrey. First phase, instability. So when our bodies move, if we have traumas, slips, falls, bumps, posture over time, there are going to be certain joints in your back that start to move more than others and ones that don't move as much as others. Either one of these can cause you to move into this dysfunction phase. So the best example is to look at a pregnant female. So pregnant women, in and around the second trimester of pregnancy, the body starts to release something called relaxin. Relaxin helps the muscles, the ligaments to start moving more, and the pelvis starts to soften up to allow the baby to come through the birth canal when we get to the end of the term. Now, the body is going to start moving more, there's going to be some instability around the sacroiliac joints and the muscles around the back, which can mean it can be more susceptible to damage. So that's instability. When things are moving too much, if you look at this joint here, this is the back of the spine, if this joint is moving too much like this and the ligaments are not holding it in place, it's going to put more pressure on the disc. It's also going to put more pressure on the nerve. So we need to make sure that we're trying to get your back as stable as possible to avoid it from going into the dysfunction phase. So this is my number 1 exercise to try and increase stability in your back. Okay, so on your back like this, keeping the core nice and tight. It's all about core stability here. Now, this one, keep the head tucked down. You're very, very gently going to try and drop one leg down like this. Keeping the core nice and tight, keeping your back nice and flat. The heel just touches the bottom and you come back up like this. Very, very gently again on the left-hand side. Heel touches the bottom. And then we come back up like this. And then here. And then come back up. This should be very, very slow, okay? All the while keeping this nice tummy tight, back nice and flat. So that should help increase stability in your back to avoid you from going into dysfunction phase. So that's the first phase, instability. Phase number 2, if the body gets too unstable, then you're going to start getting dysfunction. So dysfunction is where the bones, they're moving too much, instability. Dysfunction means they're not going to work properly, which means they're not going to put the force through the facet joints. There's going to be more force going through discs or more force going into the nerves. The too much force going on the discs, we all know what happens. We get a disc prolapse or a bulging disc or an inflamed disc. That's the dysfunction phase. So we're starting to get things that aren't working properly. Now, at that point, we've got to try and get pressure off the joint, off the nerves to avoid us from going into the pain phase. So what is my number 1 tip to make sure that we're getting out of the dysfunction phase and not going into the pain phase? Okay, so I love cat camel. This is cat camel yoga pose like this. Back goes up, around the shoulders, tipping the head back like this. This will get us out of this dysfunction phase. Help those ligaments start to expand, have to stretch the base of the spine out and making sure we're not putting any pressure on those discs. Like this. So anything from 10 to 30 seconds. I like to do 30 seconds and try and do 3 times. Okay, it's going to really help to alleviate pressure off the base of the spine and get things to start moving better. And then go back 1 phase into the instability phase, start to get things more stable. Now, third phase, if we can't fix the instability, if we can't fix the dysfunction, you are going to start getting pain. Now, pain comes later on. So pain is always the tip of the iceberg. So remember, when the pain goes, you've still got dysfunction and instability. So the painful phase is where there's going to be pressure on nerves. Nerves are simply your body's way of saying, hey, something's not right here. We need to make sure we're getting pressure off, allow you to get back into the best position. So pain is always a warning sign that you need to start doing the dysfunction exercise, and then we start going back into the instability exercise to gain traction, gain core stability, which is the heel downs. And then we get to recovery. So if you've gone through all of those and the pain has been there for anything from 6 to 12 weeks, we go through to the recovery phase. So recovery phase is all about trying to build that core strength, got pressure off, and it's all about trying to prevent that problem from coming back in the future. Meaning that you can keep on exercising, you can keep on playing with your kids, keep on messing around with your grandkids to ensure the problem doesn't keep reoccurring. You want to prevent the disc prolapse from coming back and get the pressure off your back. So, how do we do recovery? Okay, so it's all about trying to strengthen the core and the glutes for recovery. So I've got a very light dumbbell here. We're going to do a bit of dumbbell work. Now, if you haven't got a dumbbell at home, you can use like a bag of sugar. You can try and get something that's a similar sort of weight. Anything from sort of 3 to 5 kilos, maybe a couple of bags of sugar for that. Try and get yourself something that's like this. So the first one is, I love doing a squat. So simply holding the dumbbell out in front of you like this, keeping the elbows tucked in, squeezing the tummy in, squeezing the glutes, and trying to drop the body down, keeping the knees behind the toes, and then coming back up like this. Remember, keep that core nice and tight, all the way down. You're at the bottom here, squeeze the bum, and all you're doing is pushing through those glutes. It's going to increase that core contraction. And you want to try and do 10 repetitions of this. Dumbbell out in front like this, bum comes back, all the way down like this. Like that. At the bottom here, squeeze the glutes, sit back up. I'm not doing this. Yeah, that's not good. Keep that back nice and flat. See how my head is pointing up, shoulders are pointing up. I'm not rounding the shoulders. Nice and upright like this. Knees. Don't go in front of the feet like this. My bum comes back like that. So not this. Bum comes back like this. I'm coming back up like that. Bum comes back. See how my knees don't move too far forwards? They're definitely not going in front of my toes. Like this. The second one, a lunge. Now, I don't do a forward lunge like this because it loads up the knees too much. I always do a backward lunge. So, straight on like this. Leg goes back, all the way down. Similar concept for the squat. I'm really trying to suck the tummy in, trying to squeeze my glutes and give all the contraction around here and into my back, get my back nice and stable. Like this. 10 reps, each side, 3 sets. You see, from the side, bum comes back. Like this. Knee brushes the floor, and it comes all the way up like this. Leg comes back. Knee brushes the floor. And right on the bottom here, squeezing that glute. Squeeze this one here. Squeeze the other one, suck your tummy in, push straight up. Okay? When I come down, I'm not going forwards like this, I'm going straight up. Okay, so going to increase all the contraction through the glutes here. Okay, so there we have it. Those are the 4 phases of back pain. Make sure that you're working through each phase and trying to prevent you from going into the next phase until we get to recovery. Bypass dysfunction, bypass pain, get yourself into that recovery phase, start building the strength of the core. If you like the video, please hit the like button. If you subscribe to the channel, you get our 2 weekly updates on new tips of how you can manage your back pain and get back to being fit, mobile, independent, long term. Grab copies of my best-selling books here, The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, How to Transform Your Back, in Amazon on the show notes below. Speak to you next time. Thank you.